U.S. Surgeon General, Vice Admiral Jerome M. We also have today Mayor of our county, Carlos Gimenez, our local mayor, Stacy Bermudez, our Commissioner, Jose Pepe Diaz, County Commissioner Audrey Edmondson, and local restaurateurs and hotel members here, as well as a member of WTDC who's holding the mask for all our restaurants for free for Dade County. Thank you for everyone in attendance. And obviously, I cannot forget the Lieutenant Governor, Jeanette Nunez. You know, our governors and mayors are working so hard to make tough choices with one goal in mind: keep us all safe. And I thank each and every one of you of your leadership. On behalf of Sergio's and the Florida Restaurant Lodging Association, I'm proud to announce that the Surgeon General Adams and his U.S. Health and Human Services Department will be announcing today that he is donating nearly 1 million washable covered masks for hospitality employees throughout the state of Florida. Thank you doesn't seem quite enough. So I just want to tell you from the bottom of our heart here at Sergio's that we are so grateful for this donation. It's really going to help us keep our employees safe. So today and throughout the next couple of weeks, we'll be distributing these masks throughout hospitality employees through Miami-Dade County, Monroe County, and throughout the state. Before I invite the Mayor Gimenez to say just a few words, I just want to say, Mayor, thank you for having me part of the restaurant initiatives that you've been doing to come up with ideas of how to keep our public safe and our restaurants open. He has been instrumental in emphasizing that everyone must do their part and wear masks. You know, a lot of people don't remember that Dade County was the first county to have mandatory masks in the state of Florida. Wow. And it's up to your leadership, and I hope and I know that you're going to be proud of this collaboration that where a small business like Sergio's, the Florida Restaurant Lodging Association, the federal government, local ordinances, state, all come together.
Thank you. Thank you very much, Carlos, and thank you for that introduction. You know, I guess everyone can tell why Carlos is helping lead Miami-Dade County's restaurant initiatives team. Carlos and everyone he works with have a real passion for their local businesses. They also have been working with our medical experts to safely get our local restaurants up and running again, beyond delivery and outdoor dining when possible. Before I share a few words about our efforts here in Miami-Dade, I want to welcome U.S. Surgeon General Jerome Adams. Thank you, sir, for being here to our county. Surgeon General, thank you for being here today to announce this generous donation of masks that for use throughout the hospitality industry. It's really something worthwhile and something that we really appreciate. I also want to highlight the federal government's partnership in opening up 2 new pop-up drive-ups. They're testing sites here today. One of them is at the Miami-Dade County Auditorium, and the other one is Miami-Jackson Senior High. Those 2 pop-up sites will be able to each test 1,000 Miami-Dade County residents here in Miami-Dade. And again, pop-ups, it's pop-up because it basically just popped up. It wasn't there yesterday, and today when you look, it's there.
And they tested 70 people in the first 30 minutes. They are churning them through, but as the mayor always reminds me, make sure you make an appointment first, because we want to be able to keep up that efficiency, and we can keep up that efficiency if you make an appointment. But testing is free, available to people down to the age of 5. Easy, you just drive up. Once you have your appointment, you show them your appointment, and they will walk you through how to self-swab. So you actually swab yourself, put it back in a test tube, and the mayor and the lieutenant governor and I literally just went through a demonstration. It's as easy as can be, as quick as can be. If you are in a at-risk group, and you can go to coronavirus.gov or the Florida Department of Health to find out if you're in an at-risk group for any reason. It may be because you went to a large gathering. It may be because you have symptoms that are common for coronavirus. Then please, these sites are here for you. Get tested so we can figure out whether or not you need to isolate, and then we can contact trace and make sure other people aren't going to be sick if you are someone who is carrying the virus and doesn't know it, or who actually has symptoms and just needs to get tested.
And thank you for all your efforts, Surgeon General. Really appreciate it. Also with us is Jeanette Nunez, the Lieutenant Governor of the state of Florida. She's going to say a few words, followed by the Surgeon General, and then I'll wrap up in English and Spanish, telling updating everybody on what we're doing here in Miami-Dade County. And so, without further ado, Lieutenant Governor Jeanette Nunez.
Thank you, Mayor. Thank you so much for all of your hard work during this pandemic. And I want to thank Carlos and his family for having us here today. What Sergio's means for our community is much more than just a restaurant. I was telling the Surgeon General, it is an iconic institution here in our county. It's not just where people go to share a meal. They go to share their stories, their dreams, their hopes. And that's represented by the staff that works here. And these commissioners that are here with us and the mayor, they know all too well the importance of an institution like Sergio for our community. And I know I see many restaurateurs in there, and it runs in my own family, as a matter of fact. Cafe Violeto, my cousin Ernie's here, and great to see him. But it is so important that we work together. I think you've heard the Surgeon General say everyone has a role to play in this pandemic. And that's why on behalf of Governor DeSantis, we thank the federal government for their collaboration. We thank them for those testing sites that are going to be essential in battling COVID-19. We thank them for their generous donation of these masks that are going to literally save lives. So we ask everyone, do your part. Help us help you. We want nothing more than to return back to the normalcy. We want nothing more than to return back to the path of prosperity that Florida was clearly on. And so together with our elected leaders, with our business leaders, and the collaboration and support from our federal government partners, we thank them and we implore you to please join us in this battle so we can get through it quickly, get through it safely, and get back to our lives. Thank you so very much.
Thank you.
Surgeon General, you want to say a couple
Carlos,
words?
I just want to thank you and your family for hosting us, and the other restaurateurs here. Raise your hand. Fantastic. This is wonderful. This is really wonderful. You know, the Lieutenant Governor was telling her story, so I'll tell mine. I actually learned how to do math working the cash register at my father's restaurant and bar growing up. So I have a deep connection to the restaurant and bar industry. It may seem odd that the Surgeon General is at a site like this, but one of the things that I've been saying all day long is that I love getting outside of D.C. and getting to be with the people and see what's really going on, because it often is not what you see or hear in Washington, D.C. And we know that health happens in communities and that restaurants are part of that community. In many cases, they are an integral part of the community, as Sergio's is here in the Miami area. There are places where you have birthday parties. There are places where you have bachelorette parties and weddings and all sorts of different family activities. And it's important that we do everything possible to support those restaurants, to open them safely, to keep them open, and to keep the workers in those restaurants open, and to make sure that the vulnerable people who come into those restaurants can feel that they can go out and have a meal and do it safely. And that's what today is really all about. In D.C., we have a tendency to pit one thing against the other. It's all or none. You're either red or you're blue. It's either black or it's white. Well, it's not either you reopen or it's not that you're either pro-health or you're pro-reopening. It's that it's both. We have to reopen safely, and that is why we are so proud, Sergio, to make this donation. I want to thank all the political leaders who are here with me today, because it shows that this transcends politics, that this is about the community. We're really trying to keep people safe. People of Florida, please hear me when I say this to you. This face covering is a really small gesture. It may seem like an inconvenience to you, but you know what a much bigger inconvenience is? It's if Sergio's has to close. It's if someone goes out to a restaurant and gets infected when they didn't have to because we weren't doing our part. It's if our schools have to close. It's if we miss a wedding or, heaven forbid, can't go to a funeral of a loved one because disease spread is too high in our communities. So we all need to take the small measures that we can now to avoid big inconveniences down the road. And this is the simplest thing that we can do that will have such a big impact. And so I just thank you for the opportunity, all of the restaurateurs, to come here and to be able to provide these masks to your workers so that you can protect your community, so that you can reopen, so that you can help these families start to heal from the devastation that COVID has wreaked upon our country. I also want you to know that in the South and Southwest, we've seen increasing cases. Miami is no exception. Florida is no exception. But we are starting to see the rate of acceleration of cases slow down in Miami. And across Florida, the numbers are leveling off. And that's a testament to the people who are doing the right thing. You constantly hear about the people who are doing the wrong thing. A lot of people in the United States, in Florida, and in Miami are doing the right thing. And we need to acknowledge and recognize those people who are doing the right thing. Little Eli, I just met a little young man who looked like he was about 9 or 10 years old, about the same age as my daughter, out in the parking lot. He was proud to show me his mask that he was wearing. It had a special design on it. We need people to understand that wearing a mask is cool. It is the right thing to do, but it's the cool thing to do. It said earlier with the mayor, Dwayne Wade was just talking about wearing masks. If you won't do it because I say so, do it because Dwayne Wade says so. We need to all come together, get that message out, that the 3 W's, watch your distance, wash your hands, wear a mask, are how we open and stay open and keep our loved ones safe.
Thank you. Thank you, General, and very, very wise words. And it's really a consistent message, right? And just to keep our distance, the 3 W's, wear the mask, keep your distance, and wash your hands. And so that's all we need to do. And if we do that, and if we all do that, we can drive this contagion down. And then we can get back to reopening up spaces like, unfortunately this space is closed because it's a restaurant, because you can't eat without your mask on. If we get the level of contagion down, then we can reopen these spaces. And if we get the level of contagion down, we can, look forward to opening schools with children. And it's really up to all of us. And really, I look at this mask as a sign of respect that I have for you. Because I could be contagious. And I could be contagious because 60% of the people that have it don't have any symptoms whatsoever. And so we have to watch out for one another. And our motto has been, I take care of you, you take care of me.
Exactly.
Right? And if we all take care of each other, then we can get this level down and we can start living a much more normal life and we can get people back to work. People that right now don't have a job because there are certain things that are closed. And so, I think it's the right message, it's a consistent message throughout the United States, especially here in Miami-Dade. We are a hot spot, and so we've got to take even greater care here at Miami-Dade than other parts of the state and of the country. I want to thank our chairwoman of the County Commission, Audrey Edmondson, for being here. Also, Commissioner Pepe Diaz, and then our mayor from Doral, J.C. Bermudez. And what you have here is a demonstration of federal, state, county, city, all working together. All have the same message, what we have to do as a community to bring the level of contagion here in Miami-Dade County down. And the good news, as the Surgeon General has said, is that it is the rate of increase is starting to slow. We've actually seen some decreases. We've seen the rate of contagion also stop. It was in the 20s, and now it's looks like it's starting to get into the teens. That's not nearly good enough, but it is in the right direction. And so we're going to continue to, the measures that we've taken, the curfew, some of the closures, wearing masks inside and out, those measures are going to continue. We're going to now continue with our enforcement efforts, because while most people comply, some people don't.
Exactly.
And some people didn't. And that's why we got to the contagion level that we have right now in Miami-Dade County, because some people did not. We saw a sharp rise in the positivity rate in Miami-Dade County right in mid-June, probably due to younger people. We saw that rise with younger people. Probably they thought, hey, this thing may be over. It's not going to be, too big a deal for me. Well, it's a big deal. It's a big deal because maybe even for young people, some young people, it actually affects pretty harshly, and actually there are deaths with young people, but those young people then take it to the older folks, the folks that are really more likely to have serious consequences from COVID-19. And so we need to, again, wear these masks as a sign of respect for one another, wear these masks as a sign of respect, and also that we're in one community and that we want to beat this virus, and we want to get our people back to work, and we want to get our children back in school. And the way to do it is wear the mask, keep your distance, wash your hands. Pretty simple. It's not, it's not the end of the world. We're not asking you to do something which is impossible. We're not asking you to do something that we don't do ourselves. And so you will see us, with the mask.
Do we have some masks that we can show? And while Carlos is talking, I want to, you made me remember that I don't know how to cook the #1 croqueta in Miami. And so I shouldn't assume that all of you all know the science behind wearing a mask. A lot of people know, and when they aren't being so nice to me, they like to point out that we and I advised against wearing masks in the beginning of the pandemic. And I want you to know that we did that because based on every other respiratory virus we knew up until that point, we didn't think people could transmit the disease before they had symptoms or if they didn't have symptoms. What that means is if the mayor was standing next to me and the mayor had a runny nose and watery eyes and was coughing and sneezing, I would say, don't stand near me.
That's right.
And Carlos would say, you need to go home. You can't come into work. But the problem with coronavirus is that we've learned that unlike any other similar virus out there, a lot of people, over 50% in some cases, can transmit this disease without ever knowing that they had symptoms. So I can't just look at you and tell whether or not you have symptoms and tell you whether or not you need to go home from work or whether or not we should be on a plane together or whether or not we should be hanging out together. So the next best thing that we can do is wear a face covering, a face mask, so that in case we have coronavirus and don't know it, we won't spread it to other people. That is the science behind why we do it. The benefit of why we do it is because it will allow us to open and stay open, people to have jobs. For every 1% increase in unemployment, you have a 1.3% increase in suicides. There is real harm to us being shut down, but the fastest way to reopen is by lowering disease spread in communities. The thing that is the biggest impediment to us reopening is disease spread in communities. And so we've got a simple tool that will help us reopen. And it even says on the package, do your part, stop the spread. That's all we're asking of you. Do your part, we'll do our part, and together we will defeat this disease and we'll get back to normal, or at least some sense of normal, a lot more quickly. I can prove to you it can be done. Italy, just a few months ago, was one of the hardest hit places in the world. They're now open for tourism again. They're now opening school again. They're now playing soccer again. Why? Because they took the measures to suppress disease transmission rates. We can do the same thing here in a matter of weeks to months if we all do our part, and today's a big start of that.
Right.
So thank you again, Mayor. Thank you again, Carlos. Thank you, Lieutenant Governor. Thank you to all of, and the people who have the coolest masks are behind us. I actually love the flags. But these will do too, and my daughter actually took a pack of these and tie-dyed them. So if you want to have a fun activity you can do with your friends, with your kids to make it cool, then you can tie-dye your mask too. But find a way to make it cool and just, most importantly, wear it.
We agree. One final thing that I want to stress too is that even inside the house, even inside your home, because we have such a high level of positivity rate here in Miami-Dade, you also need to start thinking about maintaining a distance also from your loved ones for a while. Yes, I know it's a sacrifice, but do so because, again, just because it's your son or your daughter or your cousin or your mother or your father doesn't mean they don't have COVID, all right? COVID-19, because as the Surgeon General said, the majority of the people that have it don't even know it. And those people that have it and don't know it are spreading it and can spread it. And so if we all do that and we take care and we watch ourselves and we stay safer at home when you don't have to go out, then we can actually start bringing this down. We can bring our hospitalizations rate down. We can bring the people that are in ICUs down, the people that are on ventilators down, and then we can start again to open up our economy. And then when we open up the economy, we got to make sure when we start opening up again, the certain segments of the economy that are closed today, that we can't forget to maintain and keep the same measures in place because that will allow us to keep everything open and get back to a much more normal way of life. That's really what we want to get to, a much more normal way of life where everybody is working, everybody can greet each other, everybody can say hello, everybody can go back into a restaurant, everybody can eat, etc. in a restaurant. As long as the contagion level is low, we can do that, but we all have to do our part. And so again, this is a symbol of my respect for you. That's a symbol of your respect for me. It's also a symbol of community. So if you're not wearing a mask, then you may not be part of this community, all right? Or at least you're disrespecting the other members of this community because you don't know if you have it or not, all right? And so, again, thank you. Thank you, Carlos, for hosting us here today. Madam Chair, everybody, thank you very much.
We got some masks.
¿Qué? Sí, cómo no. Estoy muy agradecido al general de los Estados Unidos, el señor Adams, que está aquí, y también el mensaje que tuvo. El mensaje es muy simple. Utilice la máscara, mantenga la distancia, lávase las manos. Utilice la máscara, mantenga la distancia, lávase las manos. Esa es la única cosa que tenemos que hacer nosotros para bajar el nivel de contagio aquí en el condado de Miami-Dade. Y no solamente aquí en el condado de Miami-Dade, en la nación. Y si hacemos eso, esto es un símbolo de respeto que yo tengo a ustedes, porque yo no sé si yo tengo el virus, sino porque 50-60% de las personas que tienen el virus no lo saben, no tienen síntomas. Y si nosotros todos, como una comunidad, hacemos esas tres cosas simplemente, vamos a bajar el nivel de contagio aquí en el condado de Miami-Dade. Vamos a poder otra vez abrir esos negocios que están cerrados para que nuestros vecinos puedan regresar a trabajar. También puedo bajar el nivel de contagio aquí en el condado de Miami-Dade para que nuestros niños puedan regresar al colegio, algo que es muy importante para nosotros y para ellos también, para su salud. Así que el mensaje es muy simple. Manténgase, pónganse la máscara, manténgase la distancia, lávese las manos. También, acuérdese que adentro del hogar puede ser que hay alguien adentro que vive con usted, tu primo, tu hijo, tu madre, tu padre, que puede ser que también tenga el COVID-19 y no lo sepa. Así que adentro de la casa también manténgase un poquitico de cuidado, porque el nivel aquí en el condado es bastante alto y puede ser que alguien que está viviendo con usted puede ser que tenga el virus, se tiene que cuidar. Y también vamos a cuidar a las personas que son mucho más vulnerables, que son las personas de la tercera edad y también las personas que tienen un tipo de problema médico, una condición médica. Tenemos que protegerlos a ellos y también acuérdense que es mucho más seguro en la casa. Si no tienen que salir, no salgan. Pero cuando sí salgan, por favor, usen la máscara, mantengan la distancia, lávense las manos. Gracias. Sí. Eso lo puede hacer Carlos si él quiere, porque él fue la persona y fue Sergio que empezó esta iniciativa. Hay 1 millón de máscaras que está donado por el gobierno federal, pero él puede...
Sí, esto fue algo que Dade County fue el county primero en los estados de la Florida que decidió poner máscaras mandatorio. Entonces nosotros como negocio de Sergio's hablamos con el FRLA, el Florida Restaurant Lodging Association, y pensar cómo podemos hacer nuestra parte. Contactamos al Health Human Services con el U.S. Surgeon Adams para ayudar a nosotros, especialmente que Dade County tiene mucha gente mayor que sale a comer y nosotros estamos muy preocupados de asegurar que estamos haciendo el ejemplo. Entonces, eso fue el principio de las conversaciones. Entonces, conversamos con el Estado, con localmente y reunimos todo el mundo para poder hacer este esfuerzo y siempre pensar de nuestra comunidad, nuestros clientes y, por supuesto, nuestros empleados.
So you got to help me out here. Yo soy U.S. Surgeon General Jerome Adams. Habla español muy poquito. Por favor, wear a mask. Muchas gracias.
U.S. Surgeon General, I do want to say...
Say this. Utilice la máscara.
La máscara.
There you go.
I do want to say that we need about 175,000 people to donate plasma. I think those are the true heroes. I wanted to bring that up, U.S. Surgeon General, because you talked to me outside about that, so I just wanted to make sure that we highlighted that the true heroes in our next wave is really our plasma donors. I don't know if you want to say something really quick about
Well,
that.
we know that by donating blood, one person donating blood can save up to 3 lives. And that's before you even take COVID into account. We know that blood donations are down, and we know that because of matching, it's important that particularly people of color, people of different ethnicities give blood, because your blood may not always match someone else's of a different race or ethnicity. So number one, please make an appointment to give blood. Please also understand that if you have recovered from COVID-19, from the coronavirus, then your body has antibodies to the virus, and you can donate you can donate your plasma and give other people the benefit of those antibodies and can save a life. So when we say donate plasma, we're asking you to make an appointment at your local blood bank. If you've been diagnosed with COVID and recovered from it, and if you got a test and know you had COVID, you can go in and they can do a antibody test to see if you have antibodies. But please, if you've recovered, consider donating plasma, because right now it is one of the most effective remedies that we have and treatments that we have for people who are suffering from COVID right now. It's another way you can save a life in addition to wearing a face covering.
Mayor, it's up to you now if you want to go outside to start.
That's okay. Well, we're gonna.
Are there questions?
Yeah.
General Adams.
Yes.
Hi, Doug Hanks from Miami Herald. President Trump was to come here next weekend. Does it matter if he wears a mask?
When the president comes here? Well, I want everyone to wear a face covering for medical reasons. It's important to understand when you talk about the President of the United States, he's tested, and so he knows that he's not likely, very unlikely, to be spreading the disease from a medical point of view. What I can say about the President is I'm really proud of him for wearing a face covering at Walter Reed last week and for continuing to talk about the importance of wearing face coverings, which we've been doing as part of the task force for several months now. And I think it's important that all of us do what we can to promote face coverings in communities and understand when we could be in a position to be asymptomatic carriers. So from a medical point of view, I encourage people to wear them. Understand that the president is in a different position because he knows that he is negative for coronavirus before he goes out into the public. From a public perception point of view, there are a lot of people who look up to the president and who do what he says, and so I'm proud of him and appreciate that he is wearing a face covering when he goes out and shows people that this is something that we should be doing. I don't know whether he will be or not, but again, it's important to understand the why behind it, and important to, again, acknowledge people who are doing positive things. And twice in the past week, I've seen him wear a face covering, which is something people have been asking for a while, even though it wasn't medically indicated necessarily for him to do so. And I applaud that, just as I applaud you wearing a face covering and all of us up here wearing a face covering.
So what made you proud about being able to wear the mask? Why was that?
Well, again, we all have our own different groups of people who listen to us. I brought up Dwayne Wade earlier. There are people who will listen to Dwayne Wade who won't listen to me as Surgeon General of the United States. There are people who will do what the President says who don't listen to the Surgeon General of the United States. And so I do think that the President has consistently said he thinks other people should wear face coverings. Now, I think that he very much wants people to understand that not only is he saying it from a medical perspective, but he wants people to emulate him. He says they're patriotic, and so I'm all for that. I'm all for anyone wearing a face covering at any time for any reason, both from symbolic purposes and also for medical purposes.
The different conditions is that our contagion level is higher, and so the problem with restaurants, interior spaces, is that I don't know of any way to eat without doing this. Okay, and once you do this in an interior space with a contagion level that high that we had, about 20%, it makes it an inherently risky proposition, because it means that every 4 or 5 people that you have eating at the restaurant, one of them is one of those people has COVID-19, and we know that it spreads much easier interior. Remember, the circulation in interior spaces is recirculated air, and we know that the virus lives longer in recirculated air interior spaces than it will be outdoors. Outdoors, you have 100% fresh air. You can maintain a social distance, and it's not as dangerous as being inside.
And I just want to support the mayor on that really quickly, excuse me. One of the things that we're telling communities that have been hard hit by coronavirus is to avoid indoor gatherings as much as possible, to lower indoor dining, or to get rid of it altogether, to close bars. Why? Because we know that that's where the spread is occurring. And so it brings us back to the point of today that the number one thing that we can do, that all of us can do to help get things open as quickly as possible and to keep them open, is to encourage everyone in the community to wear face coverings, because as long as there's a high background rate, then the science is going to tell us that we need to keep indoor spaces shut down or get indoor gatherings to a minimum. But as we can get that prevalence down, again, when you look at Italy, when you look at Wuhan, when you look at other countries, they're now open back up for business again because they have the prevalence rate down. Not because the virus went away, not because it's less deadly, not because we have a vaccine, not because they have better therapeutics than what we do, but because they've been able to get the prevalence down. And so I completely understand folks wanting to reopen as soon as possible. The quickest way to reopen is to make sure everyone in the community is doing what they can to lower spread of disease. And so I apologize. I just wanted to jump in because I feel the pain in those communities. Yeah. Exactly. And one of the things that we're doing is trying to help the different counties and cities understand their own disease prevalence rates. But you also, again, the politics are different in different communities, and so people have to figure out what's going to work best to motivate the individuals in their community. You've got a mayor here who's been mayor for 9 years.
9 years.
Right?
Yes, sir.
And so there are things that he can do because of the trust he's established with the community that other mayors might not be able to do in different communities. But we always want it to be informed by the science. And again, today we're all about promoting the science behind face coverings that we now know. All right. Thank you all.
Thank you very much.